Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear students, rather I can say, because this is the lecture of Roga Nidan Vikriti Vijnana. I think everybody knows that there are two papers, paper 1 and paper 2, and this is the topic from paper 1. But before starting the actual topic, let me clear you some revision type of the points, that which are the points which are incorporated, which are included in the paper 1. So please open your notebook, write down the date 27th of November 2023, and today's topic is regarding Nidan Panchak. Please write down Nidan Panchak, N-I-D-A-N, Nidan Panchak. There are the 5 things that one has to consider, the doctor has to consider, Vaidya has to consider while understanding the disease. So if anybody wants to study the disease, according to the Ayurvedic perspective, they must understand in 5 ways. Number 1, Nidan, then Purvarupa, then Rupa, Upashay, and Samprapti. These 5 things are called as Nidan Panchak. So in Nidan, Roga Nidan and Vikriti Vijnana subject, there is a Roga Pariksha and Rogi Pariksha. Please write down Roga Pariksha, that is the understanding of the disease, and Rogi Pariksha, understanding of the patient. So one is a examination of the patient and another examination of the disease. So we are talking about Nidan Panchak, that is the part related with understanding the disease process. So Nidan causes, Purvarupa, prodromal symptoms, warning signals. Yes, you are going to get fever. Yes, you are going to get diabetes. Yes, you are going to get some cancer. So these type of the warning signals, prodromal symptoms, preoccupied symptoms are called as a Purvarupa in Ayurveda. Then Rupa, that is actual signs and symptoms, are included in the Rupa. What is Upashay? Upashay is a therapeutical test. By some procedures, whether the patient is feeling better or whether he is not feeling the better, that is called as Upashay and Anupashay. So Upashay and Anupashay, and last point is a pathogenesis. Try to understand. Samprapti is a pathogenesis. So today we are talking about the second part of the Nidana Panchak, that is the Purvarupa. We will also talk about the Rupa. We will also try to talk about the Upashaya. So this is the part from paper 1. This is the understanding of the disease by Nidana Panchak. 5 things: Nidan, Purvarupa, Rupa, Upashaya, and Samprapti. Samprapti is a pathogenesis. Okay. Nidana, that we have already discussed in the last lecture. You can just see on the YouTube that you will get the previous lecture regarding the Nidan Panchak, first part about the topic Nidana. Nidana means Hetu, causes, etiology. Now let us talk about the Purvarupa. This is also called as a premonitory or prodromal symptoms. Are you getting my point? Okay. In all these shlokas, no need to remember any shloka. I will tell you which particular line you should remember. For example, you can remember only this first line. Can you see here? I'm sorry, just let me try to mark that particular point. I think today it is very difficult to mark that point, but yes, I will try. Pragrupam yena lakshate. Prak means before. Before actual signs and symptoms, whatever you are getting as a warning signals, they are called as a pragrupa. Prag means before, and that is called as a previous indications that yes, you are going to get this disease. Okay. Symptoms manifesting prior to the actual disease is called as a Purvarupa. It indicates the future disease, forthcoming disease. Yes, you may get diabetes. Yes, you may get heart attack. Yes, you may get the thyroid problem. So warning signals are called as a Purvarupa. Actually, in the Purvarupa, we cannot specify which dosha has been involved, which dusha has been involved. Clarity of the disease is not there. Crystal clear understanding of the disease? No. Only we can judge. Yes, this may happen, like that. So these are the warning signals. I am going on the next page. Bheda. Please write down the types of the Purvarupa. Types of the Purvarupa. First, one which indicate the forthcoming, that means future disease, but sometimes symptoms may not be seen, and if seen, they are poorly manifested. No clear-cut idea. Okay, so there are Purvarupa is of two types. Bheda means types. Here the Bheda. I am just making a cursor. Please try to understand cursor. Bheda. Bheda means types. Please write down Samanya Purvarupa and Vishesha Purvarupa. We are going to see some examples. Samanya, general, and Vishesha, specific. Okay, that we are going to see. Next page. Samanya Purvarupa, which develops from the dosha dushya sammurchana and show dosha dushya dominance. Denotes the future disease, like for example, jvara. Jvara means fever. Here you can see Shrama, Arati, Vivarnantanam, Vaisriya, and that is called as a Nayana Plava, is Purvarupa of Jvara. So Purvarupa of Jvara, how you can indicate the Purvarupa of Jvara? First is there will be tiredness, Shrama, Shrama, tiredness. Arati, that means uneasiness, uneasiness, Arati. Okay? Vivarna, what is it? Vivarnanatam. Then Vairasya, Vairasya is more important. That is loss of taste. And Nayanaplava, your eyes will be little bit like a drooming. That means drowsy, like a sleepy sensation. So all these symptoms of tiredness, not getting the taste for the food, then uneasiness, that indicates that you may get for 1 or 2 days immediately you can suffering from the jvara or the fever. You can get fever. Next, fatigue, restlessness, abnormal complexion. This is the translation of this line. First line is a Sanskrit. Now this is the translation. Fatigue. Shrama means fatigue. Arati means restlessness. Okay. Then Vaivartanam, that means the abnormal complexion. Color may be changed. Then abnormal taste, Vaisvarya, and lacrimation, etc. are general premonitory symptoms of jvara. So this example you must remember. These are the Samanya Purvarupa of jvara vyadhi. Jvara means fever. Actually, I will say that jvara can be considered as a symptom. There is also Roga Nidan subject. There is what is the difference in Lakshana and the disease that we are going to discuss. But actually here we should understand as a disease. Okay. General Purvarupa manifest after the conglomeration of dosha with dushya. This is very important terms. How the disease process takes place. For example, if I am already having some low immunity and I make a very stressful, what you can say, the speedy lifestyle, going here and there, mixing with the crowded people, and what will happen then? My vata dosha will be prakupita because of the chalaguna, excessive chala. I am already tired, but I am not considering my age, I am not considering my limitations, and I am making fast life. So that can make your immunity more low. And then this my vata dosh can attack on my rasadhatu. Try to understand. Rasadhatu will be attacked. So rasadhatu will be dushya. Prakupita dosha, they are attacking on the weak dhatu of the body. Especially in the jvara, rasadhatu is always attacked by the vata or pitta or kapha. Are you understanding what I am saying? I am already tired. I am a senior citizen. Without considering my capacity, I am always making my lifestyle very, very, very fast, mixing in the crowd, and then immediately I can get a viral fever. So vata dosha is attacking on the rasadhatu, weak rasadhatu, that is called as a dosha dushya sammurchana. And because of that dosha dushya sammurchana, you can get purvarupa, warning signals. So I will be in the evening when I do whole day, very, very fast here and there. And in the evening, I feel, oh. So my wife will ask, hello, do you want to eat? Let us take the dinner. So no, I don't want. Arati. I am feeling little bit uncomfortable. I am tired, much more tired. And there is not my taste to the mouth. So these are giving me the warning signals, and to my family, yes, Dr. Deshpande may suffer tomorrow with the fever, jvara. So these are the warning signals. Okay. So when dosha, dushya, these words are very important. Please write it down. I will mention 3 times. Dosha, dushya, samurchana. Dosha, dushya, samurchana. Bad combination. Janito vyadhihi. This line is most important. Dosha, dushya, samurchana. Janito vyadhihi. Okay. Next we will go. But here you can say with these symptoms, I am not sure whether tomorrow I will get vata jvara or pitta jvara or kapha jvara. No clarification. In any type of the fever, these pururupas are common. Are you understanding? So they are called as a samanya pururupa. Let us see further what is the vishesha pururupa. Vishesha pururupa. Specific premonitory symptoms which will indicate dosha. Which will indicate dosha. In the previous, again I will go back. Here, this fatigue, restlessness, abnormal complexion, abnormal taste, lacrimation, these are not specific as per dosha. General, samanya pururupa, warning signals. I am going to get fever. But then, if I am starting at night, for example, lot of yawning, then yes, I may think that I may get tomorrow vata jvara. So they are specific indicating dosha. But in spite of that, I start some burning sensation in my eyes. Burning sensation. In addition to previous. Samanya Pururupa will be there. But in addition, I will get burning sensation. Not yawning. Then it may be tomorrow, Pitta Jajvar will be there. Something, if I feel that I am most predominant symptom is disliking of food. No yawning, no burning sensation. Then I may get kapha jvara tomorrow. So I think you have differentiated Samanya Pururupa and Vishesha Pururupa. Purvarupa means warning signals, premonitory symptoms, prodromal symptoms, prakrupam. Prag means before. Before Rupa, Pragrupa, Pururupa. Very easy. Pragrupa, Pururupa. Prag means before. Let us see further. Then, Anya Lakshana means which foretells the future disease and it is called as a Pururupa. The same thing. 4th stage of the Kriya Kal. This is important. 4th stage. What is Kriya Kal? Please write down. I will wait. When I say write down, please write down. Kriya Kal word is important. Here, I will make the cursor. Can you see cursor? Kriya Kal. I think I can choose cursor here also. In the Zoom meeting, they have given the cursor to me also. So I will try to get some cursor if possible. I am not sure, but I will try. I will try. Why not to try? Okay. Draw. Something like they are giving me the draw. Okay. Let us see what it looks like. No, I think, but better way, I should take some, select this one. Select. I am not sure. Mouse. No, it is not coming, but I will try it sometime because that is very important to get proper, what you can say, the marker. Marker I am trying to search, but at the moment it is not easily available. But when it is available, I will let you know and I will try to select that marker. Okay. Anyway, here you can see that 4th stage of Kriya Kala. I am talking about the 4th stage. Okay. 4th stage, Shatakriya Kala. You write down Shatakriya. Kriya Kala means Shatakriya Kala. Sir, what is Shatakriya Kala? Steps of Samprapti. Please write down. Steps of Samprapti. Sir, what is Samprapti? Write down. Pathogenesis. Pathogenesis. How the disease is created. That whole process from causative factor to the manifestation of disease. All the steps in between, they are called as Samprapti. So there is a Chaya. Write down. Chaya. You must be remembering it because it is a revision from the Kriya Sharira, first year BMS. So Chaya, then Prakop, second, right? On number one Chaya, second Prakop, Prasara, fourth, Sthana Samshray, fourth, Sthana Samshray, Vyakti, fifth, and last, Bhed. Now here we are talking about fourth stage, that is Sthana Samshray. So Purvarupa are manifested, please write down, Purvarupa are manifested in fourth stage, that is Sthana Samshray. Sthana Samshray stage of Kriyakal, can you see here, represents Purvarupa by manifesting premonitory signs and symptoms of disease. Okay. Now I will go next. So I don't know why it is not moving. I will just close this and then I can move if possible. Yes. Importance of Purvarupa. Very important topic. Write down importance of Purvarupa. In the fourth Kriyakal, that is the fourth step of the Shat Kriyakal. Fourth step of Shat Kriyakal. Sthana Samshray represents Purvarupa by manifesting the premonitory or you can write down warning, warning, warning signs and symptoms. Okay. It is the stage to perform the action of treatment. Start action, because it is indicating you are suffering from some problem. So awake and do something that is indicated by Purvarupa. So that is the fourth attempt to perform the treatment. Of course, in Shat Kriyakal, in each stage you can perform. In each stage you can do some treatment. In Chayavastha, yes, you can do. In the Prakopavastha, yes, you can do. In Prasaravastha, yes, you can. So every stage is giving you the chance for treatment. In a Shat Kriyakal, every stage is giving you, the doctor, the chance of proper treatment. Okay. So this is the Sthana Samshray. So you understand which is the weak dhatu in your body, where dosha will attack on the weak, and how you can determine the weak dhatu. In the first year you have learned. What you have learned? Sarata Parikshana. Please write down Sarata Parikshana. Quality of the tissues. Whether my Rasadhatu is Uttamasar, Madhyamasar or Heenasar. Whether my Rakta Dhatu, Uttamasar, Madhyamasar, Heenasar. Best quality, moderate quality, bad quality. So whenever the dhatus are having bad quality, doshas will attack. Tishkam. So dosha dushya sammurchana. So here I have understood, okay, Rasa dhatu is becoming weak. So I will take a proper warm drinks whole night, fasting, because I know that my Rasa dhatu is weak. It is mixed with ama. So to digest that ama, I will try to be little bit fasting, drinking little bit warm water. That I can do because I got the signals. Purvarupas are there, so I am very cautious. Oh my God, tomorrow I am getting fever. Prevention is better than cure. So this is that Purvarupa. Prevention is better than cure. I hope you are understanding. Knowledge of Purvarupa gives you confirmed diagnosis of disease, but we need to see the several associated features of the disease to make the final diagnosis. For example, difference in prameha, whether it is a prameha or whether it is a rakta pitta. Some symptoms may be confusing with the prodromal symptoms. We are not sure. Still we are not sure. It is because it is just warning. We don't know what tomorrow is happening. But we get some ideas and we can start to prepare ourselves. Start to prepare the patient for fighting with the disease. So this is the stage where you can start preparing. Doctor should prepare the patient by building his, what you can say, the sthana samshraya. Wherever the attack has been taken place, that dhatu treatment should be started immediately. Samata should be reduced from rasa dhatu or rakta dhatu or mausa dhatu. Okay? Then Rupa. Next stage, Nidana Panchak. Please write down what is the today's lecture. What is today's lecture? Nidan Panchak. In short, what is Nidan Panchak? It is understanding of the disease. In Ayurveda, Rog. There are two words. Rog, Rogi Pariksha. Roga Pariksha, Rogi Pariksha. Roga Pariksha, Rogi Pariksha. Disease examination, patient examination. Disease examination, patient examination. For disease examination, Nidan Panchak. Sir, what is patient examination? Trividha Pariksha, Chaturvidha Pariksha, Dashavidha Pariksha. This is clinical examination of the patient. You may be knowing Trividha Pariksha. Anybody knows? Write in the comment, Trividha Pariksha. I will be happy if you write in the comment. I will not tell the answer right now. Okay. Rupa. What is Rupa? There are different synonyms. Here are the Pradurubhuta Lakshanam Punarlingam. This is the only line you remember. First was Pragrupam. Pragrupam, before Purvarupa. Now it is a Pradurubhuta. Pradurubhuta. Very well clear, manifested. Symptoms are clear. Symptoms are manifested. That is Pradurubhuta Lakshana, not Pragrupa. Pradurubhuta Lakshana. Pradurubhuta Lakshana. That is Rupa. So there are different names. Linga. Then here, can you see Linga? Here also Linga. This is the synonym, another names for Rupa. Then Akriti. Again, the same Rupa, Lakshana. Then Chinna. Then Samsthana. Then Vyanjana. And then Rupa. All these are the names for the one word, that is a Rupa. My dear friends, this can be asked in the oral. He asked first question, tell me the synonyms of Rupa. So dhar, you must write down Linga, Arati, Lakshana, Chinna, Samsthana, Vyanjana, Rupa. The 7 synonyms are there. Okay, let us go further. What is the definition? What is Rupa exactly? Pradurubhuta Lakshanam Punarlingam Charak Nidan Sthan. Please write down the reference. For Roga Nidan Vikriti Vijnana subject, there are 2-3 things must be remembered for reference. Just casual. Don't bother, I remember the chapter name, shloka number. No. In between, you can write down Madhav Nidan, because Madhav Nidan is the best text for Nidana subject. Nidane Madhavaha Sreshtaha. Can you write down? I will say 3 times. Nidane Madhavaha Sreshtaha. Nidane Madhava. Madhava is the name of the scientist. Charak is the name of the scientist. Sushrut is the name of the scientist. Vagbhat, name of the scientist. Charandhar, name of the scientist. Are you getting it? So this is the way that Madhava is the name of the... Very interesting. Charak is not common in these days. Sushrut is common in these days. Vagbhat, not so common. But Madhava, very common. Very common. Madhava name is even 2023. There are many people around Madhava. So this is the written by Madhava, Madhava Nidan. The book name is Madhava Nidan. So this book is a great book for the Roga Nidan Vikriti Vijnan subject. But in addition to that, you must remember Charak Nidan Sthan. Just remember the word. I'm not saying you should remember all the matter. No. Charak Nidan Sthan, Sushrut Nidan Sthan, Ashtang Hruday Nidan Sthan. At least say this. These are the references for Roga Nidan Vikriti Vijnan. Okay. So, complete manifestation of symptom is called as a linga. Okay. Darshana. Yes, my student has answered Trividha Pariksha. Very nice. Congratulations. Darshana, Sparshana and Prashna. Darshana means inspection. Sparshana means palpation and percussion. And also auscultation. And Prashna means interrogation. History taking. History taking. Thank you very much. Congratulations. Very good. So, it is a fully manifested stage of the disease with prominent clinical features. It is called as a linga or rupa. In this stage, in which complete appearance of specific symptom of the disease is seen. This stage indicate the Vata Adi dosha. Here, Adi. Adi means etc. Adi means etc. Vatadi doshas like Vata, Pitta, Kapha, and stages of the disease, whether it is a Ama stage, Pachamana stage, or Pakva stage. For example, if you consider the abscess, here I have got the abscess, then first it is immature, then that is matured and pus is there. So Amavastha, Pakvavastha. Similarly, in every disease, there is Amavastha and also Pakvavastha. Okay, Niramavastha. Amavastha, Niramavastha. This stage indicate the Vatadi dosha stages of disease, Ama stage or Pakva stage, or advanced stage of the disease. Like example, cancer. Cancer means malignancy. What is the advanced stage? Tell me, what is the advanced stage and what is the beginning stage? What is the beginning stage? When the cancer growth is restricted to the particular organ. For example, if I am talking about the female and breast cancer, then that cancer cells are only in the breast. That is the word cancer in situ. So what is that situ? S-I-T-U. S-I-T-U. Situ. Situ means at the same place where that they have originated. But after few years, few months, that cancer cells, if not treated, if no chemotherapy taken, if no radiotherapy taken, if no mastectomy done, then that cells will, with the blood or with the lymph, they will circulate in the body and they will come to the intestines. And there will be also cancer. So that particular advanced stage is called metastasis. Metastasis. Remember this. Metastasis is a spread of cancer, advanced stage, stage 4, and that is dangerous. However, this particular stage does not include the Nidan, Upashay, and Samprapti. These are the different things. Nidan is different, Upashay is the next stage, and Samprapti is also different. So this is specific. Rupa is a different thing. Next, Jvara. What is the specific Lakshana, specific Rupa of the Jvara? You must remember this. Deha Manasa Santapa. If in any disease, if you see that there is a Deha Manasa Santapa, then that is Jvara. Cardinal sign. This word is also important. Cardinals means very important. Diagnostic symptom, diagnostic sign by which I can know that this is the disease. That is called as a cardinal, very important sign. What is the difference in sign and symptom? Come on, tell me, what is the difference in sign and symptom? Sign is Vaidya Samvedya Lakshana. I have already explained it previously. That Vaidya Samvedya Lakshana, that is sign. And Rugna Samvedya Lakshana is a Lakshana. So sign and symptom, sign and symptom. For example, pain in abdomen, complaining by patient is a symptom. And when doctor examining the abdomen and he feels that at the area of liver there is a tenderness, sparsha satva, tenderness. Doctor touched to the liver and patient crying. That is tenderness and that is sign. Complaining of abdominal pain, symptom. Tenderness, sign. Don't forget that. Okay, next. So this is the cardinal sign and symptom of Jvara is increased body temperature and mental uneasiness, unpleasureness. Gulma, sparsha, parapinditatva. Paripinditatva. When you touch paripinditatva, palpable round mass is called gulma. Palpable, you can palpate round mass. Round mass is gulma. Palpated round mass is gulma. Gridhrasi. Kati te pad sanchari vedana. From kati. Spika purva kati prishtaru janu jangam padam krama. That means that specifically Gridhrasi is nothing but sciatica. Sciatical pain is starting from the buttock, gluteal muscle and up to the heel, H-double-L. So typical from the posterior side, that particular pain sensation goes, and this is a specialty of Gridhrasi. Okay. Clear-cut appearance of symptom is called Rupa. This another definition is very important. You must remember this. That is utpanna vyadhi bodhakam evalingam. Write down. Utpanna vyadhi bodhakam eva. Vyadhi bodhak. You can understand the disease. Eva linga rupam. Madho Nidan and Madhukosh is a tika. Critics. Explanation on that original text. Madho Nidan is original text. And in there, Madhukosha was another person. He has written some explanation for difficult shlokas. Additional information, additional explanation, that is called as a tika in Ayurveda. And Madhukosh is a tika of Madho Nidan. Okay. It indicates the specific disease by manifesting specific symptom of that disease is called linga. These last three lines are very important for the Rupa. Next, we will go further. Types. Types of Rupa. Samanya Rupa, not Purvarupa. Purvarupa we have finished. Now Vishesha Rupa. Same like Purvarupa. Samanyapurvaroopa, Visheshya. Here Samanya Rupa and Vishesha Rupa. For example, Jvara Samanya Lakshana. That is Samanya Rupa. Then Vataja, Pittaja, Kafaja, Samanya Lakshana. That means some symptoms typical of the Vata. For example, I am having the fever. Temperature, increased body temperature, thermometer. Okay. But that is a Samanya. Sharira Santapo. My body temperature has increased. That is Samanya Rupa. It indicates fever. But at the same time, I am having a lot of body pain, headache, joint pain, pain. Then that may be Vataja Jvara. Are you getting my point? Vataja. But I am not, that is maybe viral fever, type of viral fever. But I am not getting the body ache and all, but I am getting a burning sensation, especially in the urine. Are you getting my point? I have the fever, but I am getting burning sensation that may indicate I am having the Pittaja Jvara with infection and inflammation of urinary tract. There may be cystitis. ITIS is an inflammation. And ITIS inflammation is mostly Pitta. So this is Pittaja Jvara, infection and inflammation. Then if by chance I am having only what you can say the tremendous heaviness of my body, absolute loss of appetite, no appetite, absolute, little bit nausea, then that indicates that I am having a kapha type of the features, and that is Kafaja Jvara. So I made a distinction, Vataja Jvara, Pittaja Jvara and Kapha Jvara by specific Vishesha Rupa. Vishesha Rupa. I have explained this. Next. As we have seen the importance of Purvarupa, we must explain what is the importance of Rupa. First, we can make a diagnosis of the disease. This is the most important benefit. Then prognosis of disease. Please write down. What is prognosis? Write down. Sadhya Sadhyatva. Very important topic of Roga Nidan. Prognosis in Marathi Sanskrit. Please write down. Sadhya Sadhyatva. Whether the disease is curable, sadhya, or asadhya, incurable, curable, incurable, sadhya, asadhya, sadhya, asadhya. That is prognosis. I am explaining prognosis. Write down. I will wait. There are two types of sadhya. So here when you write the sadhya, make a flow chart. Two types. Slowly and steadily, write down. Sukha sadhya. Sukha sadhya. And another, krichra sadhya. Krichra sadhya. Sukha sadhya, krichra sadhya. These are the types of sadhya. Now on the second side. Asadhya. Below that, make again two types. Asadhya. Write down asadhya. Below the asadhya, yapya. Difficult, I know. Open your textbook after my lecture. Yapya anupakramya. Yapya anupakramya. While teaching you the Nidan Panchak, I am explaining also revision of sadhya sadhyatva. So, what is the sukha sadhya? Easily curable. If I getting the watering of the nose, little bit cold, cough, fever, CCF in GP, flu, very common. It is very interesting statement about the flu. If you take the treatment, it will be cured in 7 days. And if you don't take the treatment, it will be automatically, within a week, it will go. The same. So, Sukha Sadhya is easily curable. Then Krichra Sadhya. For example, I have that Galashandi, or the Galashandi means tonsil. Problem of the tonsils. Lot of children problem, kissing tonsils. And I am the fever, the child has a fever. Then not only antibiotic, sometimes it may need some surgery. Oh my God, surgery. So surgery is added. So that is Krichra Sadhya, difficult to cure. It is not only tablet. He will need hospital admission. That is Krichra Sadhya, difficult to cure. But it is curable. When you remove tonsil, gone. Tonsillitis, finished. Second part. See in the note, Asadhya. Now there is first, Yapya. What is Yapya, sir? It is incurable? Yes, it is really incurable. But if the patient follows Pathya, do's and don'ts, and if we take proper care, then okay. Actually, it is incurable. But with the Pathya, with do's and don'ts, he can prolong his life and also quality of life. The simple examples, diabetes mellitus. It is not actually curable. Nobody can say that I will cure diabetes. He is a cheater. He is a fraud doctor. Remember my words. If any allopathy Ayurveda doctor says, any Ayurveda, allopathy, homeopathy, I will cure the diabetes. No, my dear friends. It is not curable once it is there. It can be under control. Diabetes can be under control, but it cannot be cured 100% for lifelong. No. Don't make such unscientific. That's why this is Ayapya. According to Ayurveda, Yapya. And what is Anupakramya? It's totally impossible to have any management for that. Cancer, for example, HIV last stage. No hopes. Just symptomatic, prolonging life. Actually, he is no more. So these are the 4 types of sadhya. So if the rupas are too many Purvarupas, then the condition is not good. That is Krichra Sadhya or Yapya or Anupakramya. But if only one symptom, then easily curable. So we can decide the prognosis. 5th Kriyakal. Again, remember the Shata Kriyakal. Chaya, Prakop, Prasar, Sthana Samshare, Vyakti. In Vyakti stage, Rupa, or we get understanding of Rupa. In Vyakti stage, 5th stage of Kriyakal or Shata Kriyakal. Nomenclature of the disease. We can decide, we can give the label to that decide. For example, here you can see Dhanrastamba or Udara Vyadhi. Udara means ascites. Forget about this, tetanus. Basically, Udara is very simple. Udara means accumulation of fluid in the peritoneal cavity. That is ascites, big abdomen, ascites. Then Pratyatmaka Lakshana. Pratyatmaka means very specific cardinal signs. Santapo Dehamanasaha. Very specific of Jwara. I will add another 2-3 I remember from my college days and in the practice. I am going to tell you the Pratyatmak Lakshan of Kamala. Jaundice. Kaman lati iti Kamala. Kaman lati iti Kamala. Loss of desire of anything. Not eating food, not drinking water. I don't want to do anything. Kaman lati iti Kamala. Jaundice. Atisar. Pratyatma cardinal symptom of Atisar, loose motion. Gudena. Purposefully I am speaking slow because I expect that you should write down. What is that? Gudena. Bahudravasaranam atisaraha. Budena. Bahudravasaranam atisara. When the lot of loose motion, watery, then it is called atisar in Ayurveda. Third, next. Pravahika. What is the, here I am talking about Pratyatma Lakshan. Pravahamanasya pravahika. Pravahamanasya pravahika. Straining while defecation. This is occurred in amoebiasis. Okay. So these are the points for importance. Next. We have finished Purvarupa. Today we have finished Rupa. Now we are talking about Upashay. Okay. What is Upashay? The word pleasure used in the context to Upashay means which gives happiness and pacify the disease. You write down into bracket what is Upashaya. I will tell you some English word. It is not exactly equal to, but very similar. Therapeutic test. Please write down. Therapeutic test. When we are in a confusion whether this or whether this is avastha or this avastha, then we can do something, and then according to the effect of that advice, what is happening, then we can decide. I will give the example afterwards, few minutes. Upashaya means which gives pleasure to the person by use of medicine or by use of diet or by use of regimen. Their action may be directly against the cause or to the disease itself or to the both, that is cause and defect. Okay, we will see further. Upashaya means which bring about feeling of happiness. There are two words, Upashaya and Anupashaya. Please write down. Upashaya, UPA, Upashaya, and number two, Anupashaya. That is Anupashaya. Anupashaya, not getting relief, not getting happiness. Anupashaya. Upashaya, getting better. Anupashaya, not getting better. Upashaya means which bring about feeling of happiness. Factors which create the environment for happiness are called Upashaya. It is also helpful in detecting the cases where difficulty arises due to the similarities in the symptomatology. In such circumstances, Upashaya helps to diagnose the case. So in short, you write down, Upashaya is helpful. Upashaya, please write down, is helpful when there is a confusion. When there is a confusion, CONFUSION, in the diagnosis. Confusion in the diagnosis. I will give you the example. Just wait. Here, this line is very, very, very important. Charak Viman Sthan. Although it is a Roga Nidan, but it is coming in the Viman. Gudalingam Vyadhim. This word is very important. Gudalinga. That means the symptoms are not giving you the proper idea of the disease. Good, mysterious. Oh my God, OMG. What is this? What is that? Gudalinga, confusion. Good, confusing, not clear. Gudalinga Vyadhi. This word is very important. For diagnosing the Gudalinga Vyadhi, we are using this therapeutical test, that is Upashaya or Anupashaya. For Gudalinga Vyadhi, you should not forget this word. This word is very important for Upashaya. Gudalinga Vyadhim Upashaya Anupashaya Bhyam Parikshit. Very important line. Oral, they will ask you how the Gudalinga Vyadhi is diagnosed. Immediately answer by Upashaya and Anupashaya. Okay, let us see further. Classification of Upashaya. For example, just 18 types of Upashaya. Write down. Don't forget slok. Don't remember slok. 18 types of Upashaya. Hetu Viparita Aushadha, Hetu Viparita Anna, and Hetu Viparita Vihar. Simple to remember. Hetu Viparit means opposite. Opposite specific medicine against particular cause. Then Hetu means causes. Hetu Viparit, opposite, Anna, food. Hetu Viparit Vihar. We will go further. Then Vyadhi Viparita Aushadha, Vyadhi Viparita Vihar, Vyadhi Viparita Anna. Three things are always there. Aushadha, Anna, and Vihar. Aushadha, you forget about these lines. You just write down what is Viparit. You write down what is Viparit is equal to opposite. Write down. Viparita is equal to opposite. And which three things are opposite? Write down. Number one, Aushadha is equal to medicines. Here, can you see this word? Aushadha is equal to medicines. Next, you write down on the next line. Second, Vihara is equal to activity. Vihar is equal to activity. This word, can you see? Or lifestyle. And last is Anna. Third number, Anna is equal to food. Write down, is equal to food. So these things can be opposite. Opposite to what? Opposite to Hetu, opposite to Vyadhi. Then there are another further subtypes. Hetu Vyadhi Viparita Aushadha. Hetu Vyadhi Viparita Anna. Hetu Vyadhi Viparita Aushadha. Viparitarthakari, another complicated word. Viparitarthakari. Hetu Viparitarthakari Vihar. Hetu Viparitarthakari Anna. Vyadhi Viparitarthakari Aushad. Vyadhi Viparitarthakari Vihar. Vyadhi Viparitarthakari Anna. So on the left side there are two words, Hetu and Vyadhi. Are you getting my? So totally they are 18. You just remember the 18. We may see some table for that matter. Okay. This topic or these 18 types are little bit, yes, I know, I understand, complicated, little bit complicated, but slowly and steadily till the examination you will remember this. Don't worry, be happy. Okay. So let us see this table. Table is very interesting. First example, we are having the examples. So remember, try to understand examples. Hetu Viparit. Usage of Sunthi in the Shitaka. Can you see? The Jwara. Shita Kafaja Jwara due to its Ushna property. Actually, Suntha means what is that? Ginger. Please write down. Ginger, when you get while going to the Himalaya and eating the ice cream, and you are having the Kafaja type of Jwara, and you want to, because of you are exposed to the cold environment. So cold environment is a cause. Going to the Himalaya, going to the snow, going to the Kashmir in December, and you are getting fever. What to do? Then I will choose which is opposite to the cause. Cause is Shita Guna. So I must need some Ushna Guna, that is Sunt, ginger. Next, intake of the meat juice in case of Vata Jajvara. Another example, this is not same. Kapha Jajvara is different. Now Vata Jajvara. Because of my hectic, that just now I have explained, very hectic my activities, taking lectures from whole day, then moving here and there, visiting to that people, senior citizen, Dr. Deshpande, and still he is doing that. Then my Vata Prakop will take place and I will feel lot of body ache, viral fever, Vata Jajvara. Then what to do? The opposite is a Bruhana Dravya. Vata is a Dhatu Kshejanya Vata Prakop. So I need the meat juice. Okay, do you understand? Next, Vihara. Remaining awake at night in the cases of aggregation of kapha due to the day sleep. For example, if the person is sleeping in the daytime, okay, so that will increase the snigdha guna. That will increase the snigdha guna, pathological snigdha guna. Now I want to remove that snigdha guna. So what I should do? I should wake at night. That will increase the ruksha guna. Opposite to the original cause. Are you getting my point? This is the example. It may happen that during this lecture, I will not complete both the tables. So I will complete this first part. The next table you learn by yourself. You learn by yourself and slowly try to remember. It will take some time. It is not one day job. You will have a lot of questions. But first is very easy to understand. Now Vyadhi Viparit. According to specific disease. Use of antidiarrheal drugs like Patha in case of Atisar. Whenever there is a loose motion, Patha is having Kashaya Rasa, astringent, and it will stop. Patha is a very specific in the case of Atisar, that is opposite to the antagonistic to the particular disease. I will give you another example. Maha Sudarshana Ghanavati is antipyretic, antidiarrheal, anti-kapha. So these medicines are called as a Vyadhi Viparita. Then intake of food which are having Stambhana property, that is the use of Masur in Atisar. The same disease is continued here. Here the different diseases are taken, here same. If I have the Atisar and I want to control, Viparita means opposite, Vyadhi Viparita. Anna, which Anna? Which is having a little bit astringent property. The example is specific grain, that is Masura. I don't remember the English word. Please write in the comment box if you can. What is Masura? I know the Mudga, green gram, but I don't remember the English word for Masura. This is one pulse. Okay. Then we are Pravahan, making downward peristalsis in the treatment of Udavar. Are you getting my point? If the patient is having a lot of belching, and some peristaltic movements are opposite, then I must try to make a. So I will pressurize that upcoming peristaltic movement. I will try to press them down. That is activity. Vihara means activity for controlling the Vyadhi Viparita. Okay, Ubhaya Viparita. That means opposite to Hetu, opposite to Vyadhi at the same time. At the same time. Usage of Dashamula Kvat in Vataja Shoth. So Dashamula, 10 roots. This is a combination. In the market, you can get the Dashamula Arishta. So Dashamula Arishta or Dashamula Kadha is opposite to Vataja causes and also Vataja Shoth disease. So this Dashamula is opposite to the Hetu, opposite to the Vyadhi. So that's why it is a Ubhaya Viparita. Then usage of hot substances and Jvaragna Yavagu against the Shita Janya Vataja Jvara, like malaria, fever with rigor. Then I must use some soups, warm soups. That is hot. Because of hot and because of the lightness, it will activate against the Niram. Samata will come down and Vataja Jvara will come down because Samata will be removed. So this is opposite to the Hetu. Shita is a Hetu. And disease, what is disease? Vataja Jvara. So Vataja Jvara can be controlled by Jvaragna Yavagu. Okay. Indulging in the activities like awakening at night, etc., which increases the Ruksha Guna in case of Tandra. Tandra is a drowsiness. Write down. Tandra is equal to drowsiness due to the intake of Snigdha Padartha followed by day sleep. I am going to the function of the marriage. I am visiting to the function of the ring ceremony, whatever it may be. And then I have the very big meal in the lunch. Lot of, in Marathi we say the agraha, forceful, take this, it's very nice, take this, jilebi, rasagulle, shikhand, all these sweets will be given while lunch. And I am so much heavy, then what I should do? I should keep some activity at night so that rukshata will increase and my both will be controlled. That means Tandra will be controlled and that Snigdhata will also be taken care of. Okay. This is the last part of our today's lecture. Hetu Viparitarthakari. Application of Ushna Upannaha substance in Pitta Pradhana Shodh. Actually, this word is very interesting. That means opposite to opposite. Viparita is opposite. But opposite to that is called as a Viparitarthakari. For example, if Pitta Pradhana Shodh, what is Viparita? Application of Chandana, sandalwood. Am I right? That is Shita Virya. That is Viparit. But Viparitarthakari means again using the same by which that particular things had happened. You have to use the same quality of the substances. Are you getting my point? Opposite to opposite. Viparita is opposite. But again to that opposite, that is Viparitarthakari. So application of Ushna Upannaha means potis to the Pitta Pradhana Shodh. Okay. Usage of Pitta Pradhana Vidahi Anna in Pachamana Shodh. Are you understanding? Pachamana means in between. Amavastha, Pachamanavastha and Pakvavastha. Amavastha means just beginning of abscess. Pachamanavastha 50-50. 50 is a raw and 50% pus is there. And Pakvavastha 100% pus. Now when it is in between, we cannot take to the Amavastha. In Pachamanavastha, we cannot go reverse. We have to turn it into the Pakvavastha. So to make the pus, we are using, ask the patient, take some chutney, pickles with your rice or with your chapati. So usage of Pitta Pradhana Vidahi Anna, pickles, chutney in Pachamanavastha. So tomorrow morning that abscess will burst. And he will, oh, doctor, good relief. Huh? In the night, in the evening, I was so bad, severe pain. It is not bursting out. But you said in the night, it takes some dinner with spices, that pickles and chutney, and I have taken in the night, it burst out. So that is Viparitarthakari. Very interesting. Huh? Then Vihara, Trasana, inducing the fear in Vataja Unmad. Write down. Unmad means hysteria. Hysteria, madness, brain problem, psychological problem. Unmad and apasmar. Apasmar is a physical problem, convulsions, epilepsy. And Unmad is a hysteria, psychological problem. So there, to that patient, we should make fear. Ah, shut up. Otherwise, I will take you into the hospital and give the prick or give the shock. Shut up. Keep quiet. Are you want to get shocked? That hysterical patient will calm down. Because actually, somebody will say, sir, he is like making a dance and throwing their clothes out, and they are very violent. Vataja Unmad. Then you should ask him to shut, keep quiet. But he will not agree. There you need hetu Viparitarthakari, not Viparitarthakari, opposite to opposite. We are not calming down. Rather, we are also aggressive. That patient was aggressive with Vataja Unmad, and doctor is also aggressive. He is saying, keep quiet. Otherwise, I will make you shocked. Then that patient will be like that, cool and calm. First he was dancing, Vataja Unmad. But when the doctor say, I will give you punishment by giving electrical shock, the patient calms down. That is the best example. So all these examples, you have to hear the YouTube video again and again, because they are not explained by any teachers in the colleges. They just read it out, all these things. But when explanation is there, very interesting. Vyadhi Viparitarthakari. Again, not Viparit. Viparitarthakari. Usage of Vamana Karak Madana Phala in Chardi. Very simple to understand. The patient is getting vomiting, but we are not intended to stop vomiting. We are giving some Madana Phala, is the best Vamaka Dravya, to see whether it is what type of the vomiting is there. So that is to diagnose that Chardi, it is a real Ama Chardi, then we are giving Madana Phala. Intake of Dugdha in Atisara, which induces the purgation. It's very easy to understand. Viparitarthakari is, in general, you can understand, is very similar to the original things. If the word, I will just go back. Can you see? Hetu Viparit is opposite. According to Samanya Vishistapurvaroopa, this is like a Vishesh. Vishesh means opposite to whatever happening. But if you see the next chart, it is like a Samanya. There is Atisar, but we are giving milk. Do you know? Is it a right thing to give the milk in the Atisar? No, it will increase the Atisar. That's what we want to diagnose, whether it is a real Atisar or not. That's why we are ask the patient to drink some milk and tell me in the evening whether you are having more loose motions. Then yes, pakka diagnosis. So to confirm our diagnosis, we are using these tricks. Okay, that means when our diagnosis is in confusion, we are using this particular Upashay and Anupashay, inducing Chardi by Pravahanam in Chardi. Just Pravahanam. Okay. Ubhaya Viparitarthakari. What is Ubhaya? Hetu and Vyadhi. Both opposite. Usage of Agru Dravya Lepa in Agni Prushta Dagdha, that is a burn. That is a Visha Prayog in poisoning. The two examples are separate. One is the application of Lepa, paste of Agru, which is hot in the burn cases. And second is using the Visha, Ayurvedic Visha, in poisoning cases. But this is not used most of the time. Usage of Madhya Prashana in Madatyaya. You write down this word. Madatyaya means intoxication of alcohol. Intoxication, harmful effect of drinking wine or drinking liquor. Madhya, modern Madhya. Okay. So using of Madhya Pan, Ayurvedic, Drakshaso, give the Drakshaso. to that alcohol intoxication. Then next, last is a swimming therapy advised in the Uru Stambha. Write down. Uru means thigh. Stambha means stiffness. Pathological stiffness in the thigh muscle. It's called Uru Stambha. Originated due to excessive vyayam. When that marathon runners, long run, 1 hour and 2 hours cycling from Pune to Bombay, Ghat Raja, who will be winner in cycling. So after this heavy exertion, there may be stiffness of the thigh that is called as the Uru Stambha. In that patient, it is already because of the excessive movement, but we are asking to do swimming. That is called as a Ubhaya Viparitarthakari Chikitsa or the Upashay and Anupashay. I think you have little bit idea about the first was we will discuss was Purvarupa, then Rupa, and then Upashay and Upashay. I think we have already covered the 1 hour. So let us stop over here and we will continue our next lecture of next subject. Tomorrow we have at 7 p.m. regarding the Stri Roga Prasuti Tantra subject. Okay. Thank you very much. Take care and see you soon.